Hi guys, welcome back to Bolsa Vida Chiropractic. I'm Dr. Amador and this is Dr. Garza. And we're both chiropractors and we're gonna talk about problems that you might be having with your hands. Okay, so if you ever felt some pain, numbness, and tingling in your hands, and you're afraid of what it could be, right? Let's talk about some of the quick things that we can help with. Okay, so if you're having problems with your index finger and your thumb, okay, in this area, right, of the hand, and it can go up to the forearm, right, and even further up, like you can trace it, and so that would be on that dermal tone that's for C6. Okay, so what we can do is we can go back, trace it all the way back, right, and go through it could be trapped at the elbow, it could be trapped at the wrist, it could be trapped up here in the neck. And for this area, remember, it's kind of like you're shooting. That's your C6. It would come out on C6 cervical, okay, in that area. Yeah. So we will look at for restrictions. We will look at what we call subluxations. Basically, the nerve is getting a little bit compressed, right? And that's why you're feeling that numbness, that tingling, similar to what happens when you fall asleep in the wrong position and your arm goes numb, right?
Yeah.
So what are the reasons that could go wrong, Dr. G? Why
Yeah,
could that
well,
be?
the thing about it is that the neck can get out of alignment. Okay, when it gets out of alignment, it gets twisted, it starts irritating the nerve. Then when that nerve gets affected, then it goes to what that area goes to, what that nerve goes to. And in this case, we're looking at C6 that goes to the thumb and the first finger. Okay, so that's why we need to check that area and then also be able to align it and also work the hand, make sure that it's aligned again.
And things that could be causing it is the disc. You know, the disc could be drying out. It could be diminished. Compressed. And then when it's compressed, then it's going to put pressure on the nerve, you know, and that could be sending the signal for pain, numbness, and tingling, okay? Another thing that could be happening is that if you're not having motion, we said the motion is lotion for the bones. So if you're not having correct motion, you're going to have degeneration of this joints over here, okay? And the neck is meant to move, right? And you'll see where it gaps, and all these sections are basically like fragmented. It's not a single bone. The spine is not a single bone. So each piece functions and works much like a puzzle, okay? So if you have degeneration there in between the joints, some people have arthritis, right? Yeah. And that's another thing, you know. In arthritis, we'll touch it in another video. You know, sometimes it could be, there's a theory that it could be from an infection, okay? But there's no cure right now there's no official cure for arthritis. But, you know, we can help diminish degeneration in between the joints so we can keep them in a better, stable way by maintaining it with motion, okay? And there's other things that you can take for dieting as well, right?
Oh, yeah.
Like turmeric. What other thing would you recommend for inflammation?
The first thing that I recommend for everybody is to stop the consumption of sugar and flour.
Because that's going to reduce your inflammation, right?
Got it. That's going to reduce your inflammation, and it's going to reduce the wear and tear of it. So that's kind of some of the things where you can get started. And then since you was already talking about the nerves, once you talk about the next nerve, which is C7, then that's going to affect the hand, right in the center of the hand, like carpal tunnel syndrome.
And the middle finger.
And the middle finger, right? So then, and a lot of times that happens when you're using your hands a lot. They get out of calibration. They get to start wearing and tearing. And that's where you start having the arthritis of the hands also, okay? So that's why you need to avoid those things. And that's what we can help you with.
Yeah. And then the last one is going to be the last two fingers of the hand, and that is for your C8 nerve root, which comes out between your C7 cervical and your first thoracic vertebra. Yeah. So that's where that comes out. And so we can pinpoint where the problem might be in relation to your structure, to your spine, to your shoulder. You know, it could be in the elbow. You know, so we can definitely, as chiropractors, benefit you in looking for that and helping you heal naturally.